Hey everybody, welcome back. So today's video is going to be answering questions that you guys had for me regarding my bottom surgery. I am going to try to answer them as thorough and in detail as I possibly can. So the first ones I'm going to answer are from Instagram. This person asked, what was the hardest thing to get used to after you had surgery? Was there any adjustment period to not having the old stuff downstairs? So, as far as the not having, the old stuff downstairs, didn't bother me. It was like pure excitement afterwards. You look down and you're like, it's done, it's done. Um, so, the hardest thing to get used to, I think, is just the dilation process. It's, you have like kind of a week to get better, and then as soon as you get better, you just have to start jamming this thing inside of you, and it's pretty excruciating. It's uncomfortable, but it doesn't take very long to get used to. It's like within a week, you're like, oh, this is normal. This is fine, but it's not. It's not terrible. Okay, so this one is. I know you had the peritoneal pull through SRS. I suspect that the labia majora were made from the scrotum tissue, but what about the tissue of the penile shaft of the penis? Was it used to form the inner labia? Yes. So the scrotal tissue makes the lips, and the penile makes the clitoral hood and the inner labia. And depending on how they do it, it looks very natural. I think mine looks very, very natural. I've got a lot of compliments on it and stuff, so I generally just, don't ever even think about that. Okay, so the other ones are going to come from YouTube. Let's just start from the top here. How did you select where you are going to stay in the post-op out-of-hospital period, and how was the area/place you chose? So I basically originally was looking for houses within the San Francisco area because I had mine down in San Francisco, California. And I didn't really find anything that was like affordable or nice, so we decided to go with Airbnb. And it's quite affordable. I think I paid $2,500, maybe like $2,800 for the entire month of March, which was my surgery month. And I didn't really have to deal with anybody. We didn't have any I guess landlord people bothering us or anything like that. We just kind of kept to ourselves. The area is absolutely wonderful. It's super open, super gay, super bright, colorful. Everybody just loves everybody. It's wonderful. It's a great place. If you've never been to San Francisco, particularly what was it called? The Castro. The Castro is what it was called. And it's a magical, magical place. Quite literally. So the next question is, how did you find the courage to finally go forth with it? And how did you manage to stay on the path with all the difficulties you were facing? So you really don't have a choice. Once you do the surgery, you can't just ooh, I don't like it. Let me go back. That's why I stress that it's a very, very intense decision to make, and I think that everybody should not make it lightly. They should do every tiny little bit of research, because even me, I'm very much a research person. I was still very overwhelmed with everything that I didn't expect, and all the feelings and emotions and stuff that came with that post-surgery. It was very, very, very stressful, and I can't stress that enough, that it's a very important decision. And I finally had the courage. I always had the courage. I never doubted that was what I wanted. There's times where you doubt if it's a good choice to make, not necessarily, the only choice to make, because there's so much pain and stress and sadness and happiness and all these emotions involved with the surgery, and that that has to be considered. But if you know that you need the surgery, you just need the surgery, you know. Okay, so when were you 100% sure that you were a woman? I feel like I would rather be a woman, but I don't want to transition. So I knew as early as like 5 years old. I was raised very Christian, and I remember thinking that God was like a genie that could answer my prayers and just poof, like magically grant me wishes. And so at like 5 years old, I found myself like praying at night and saying like, please let me just wake up a girl. And you know, for a 5 year old, that's too much to deal with. It's so stressful just to not feel comfortable and normal. And I think I realized that you could actually kind of change between the two around like 13ish. I saw there was like a lady that was on hormones and she had breasts, and I was like, my dad was like, oh yeah, that person used to be a guy and now they're like transitioning. I was like, you could do that? You can do that? You know, like my mind was blown. And I started doing a lot of research in my early 20s and just trying to see what my options were. And I felt as though it was too late for me already, which 20 is a great time to start transitioning if you don't know. But I waited until I was financially stable, because I hear all these horror stories of people who lose their jobs or don't have a job, and they just get like, you know, hormones from here and there, and then they miss a dose and can't take medication, you know, and that's too stressful for you to think about all the time. If I lose my job or if I can't afford it or whatever. And I knew I had to be financially, emotionally, physically stable to go through something as intense as transitioning. So, excuse me, I accidentally closed the thing. Okay. So, what's your dilating routine? And how long did it take for you until you could walk properly? So, dilation is a very intricate thing, and I think it's different for everybody. For me, my doctor had me on a regime of like 3 times a day for the first 3 months, and then after that, I go down to once a day for, I guess, a year or so. I don't know. I don't know about the next one. I didn't even know that it went down at 3 months until my doctor told me. So that kind of caught me off guard. But it is once a day currently. And what was the other part? How long did it take before you could walk properly? I was up walking around like the next day post surgery. I walked like to my Airbnb and stuff, like with my boyfriend. Had a little help, but I could walk. To walk normally probably took me about 2 weeks before I felt comfortable trying to maneuver things, you know. It's very, very intense. And even thinking about it just kind of takes me back to this dark headspace of like, oh, that was so difficult. But it is. It's a very long process to heal. So, did your doctor offer payment plans? So, I believe she does. At least for like your copay, I believe you can pay like payments on it. I just out of pocketed everything. I didn't really ask any questions. I just didn't want to deal with it. I wanted everything to be done and gone and forget about it, you know. Okay, so my surgeon is happy, so I should. Can you expand on your recovery? It's not really a question. Okay, so I'll just kind of like talk about this one. This person says, I had my surgery on May 5th, and I'm still in a great deal of discomfort. Not pain, though. So the discomfort definitely goes away. It's a very stressful thing. For me, there was a lot of like clitoral pain and like Um, Mine was pretty excruciating, but if you're just in discomfort, just give it time. It eases up. It goes away. It, I think it's more mentally taxing than anything. But yeah, just give it some time. Um, how did you select where you're gonna stay? I already answered that one. Um, any tips for going through the recovery period that a surgeon might not cover? So with this one, I think the most important thing with recovery is ice. And they will tell you, try to ice it, keep the swelling down, but ice helps with so much. It helps with the pain, the discomfort, and it honestly, I don't think I could have slept without it unless I was just like taking a bunch of pain medication, which I highly do not recommend. Um, and ice just, makes everything less swollen, and less swollen equals less complications down the road. Because here's the thing. So imagine this is your labia, right? Swelling happens, things tend to pull apart. And if you prevent that, then you have a pretty little scar. And then if you don't, you could potentially have a bigger scar, or you can have something that might need to be corrected later based on the way that it heals. A lot of surgeons won't touch you again until like a year later. They, want everything to naturally heal and then kind of go in and clean it up later. But you could possibly skip that step if you take good care of it. So this one says, how are you doing emotionally? Great. Awesome. Lovely. Much better than before. It took a long time to get here, but I'm great. Thank you for asking. How long did it take you to recover from surgery? Mine was right at like 2.5 to 3 months before I started being okay, if that makes sense. This person said, how much is the surgery and how deep is your canal? I censored that. It was a little rough, but so the surgery costs about $100,000, and the actual cost of it depends on how much your insurance is willing to pay. If you get the penile inversion technique, it's usually cheaper. I believe it's like anywhere from 20 to like, actually probably more like 10 to 30,000. The peritoneal pull through, which is the laparoscopy, like robotic surgery, is about $100,000. And how deep is it? So on my dilator, I get to the 1, 2, 3, 4, the 4th dot. I don't get all the way to the last one all the time. I can get to it, it just takes longer. So I'd say, I think 13 to 14 centimeters, which is roughly like 5 inches, 5.5 inches, something like that. Let me see if I missed any. Oh, are you able to get wet at all, or is it completely dry? So mine gets wet with friction. So if I dilate, a lot of times, like during your dilation, it will tend to, like if you're just holding it in, it tends to kind of like, the lube gets less less wet and more sticky, so it tends to want to sit. But if you kind of like move it in and out, like my canal will produce lubricant. Also, whenever I'm like turned on or aroused, my boyfriend, if we're like experimenting together, oftentimes he's even kind of shocked by the amount that I can lubricate, which can be good and bad. At least initially, you do wear a lot of like liners and stuff just to make sure you don't have any like spotting or anything like that, which is totally fine, totally normal, doesn't bother me. But yes, it does get pretty wet. I think that's all. And I just want to clarify, I just want to make sure. Yeah, so an update to my last video where I talked about being able to orgasm. 10 out of 10, everything works great. TMI probably, but also anybody who's feeling like maybe they won't be able to do that, just know that you can get it, and when you get it, it gets easier and easier and easier. The first one took me probably like 30 minutes, just kind of figuring it out until it actually worked. It was basically like the first time I ever did it again, you know. I remember when I was like younger and I found out I could do that, and I was like, whoa. And then, you know, you have to like learn your body. You have to learn what your body likes, your mind likes, your, you know, how your sensations work and stuff like that. And I can definitely say it is very easy now. So that's good. Yeah. If you have any further questions that I didn't answer, feel free to leave them below, and I will answer those appropriately, as best I can in the comment section. It's a little more difficult. Sorry for not wearing makeup. I'm a girl, but I'm also a person that doesn't wear makeup 24/7. So, anyway, thank you guys for watching, and I hope you have a wonderful night, and I will catch you in the next video. Bye.